Well, varicose veins are large, raised, swollen blood vessels that twist and turn. They usually develop in the legs and can be seen through the skin.
Spider veins are smaller, red, purple, and blue vessels that also twist and turn, and they're also most often seen on the legs and face. But the good news is there's help to get rid of both. News Channel 7's Nisa Wilkins talked with a local vein specialist about treatments.
As we get older, things happen to our bodies that we know are just a natural part of the aging process. Varicose and spider veins should not be on that list. I am here at the Vascular Associates in Panama City with Dr. Bud Shuler. Treats a lot of people who have that belief. First of all, thanks for joining us today,
Thank
Dr.
you very
Shuler.
much.
Now, what do you tell a patient who thinks they have to live with varicose and spider veins?
Well, a lot of people remember the old-fashioned treatment, vein stripping, and they really feel that there's no other options. The first thing that we do when we see patients is we really stress the conservative management, that being an exercise regimen, getting their legs pumping, wearing compression hose. The compression hose actually add extra support, make their legs feel a whole lot better.
Well, not only are they unsightly, they can also be painful.
Varicose veins can cause all kinds of different symptoms, from pain, discomfort, aching, heaviness, restless legs, and sometimes burning and itching, numbness and discomfort that really it's hard to put an exact finger on exactly what the cause is. However, when we work them up and we look at their ultrasound and whether their veins are working properly or not, we usually can pinpoint exactly where their symptoms are coming from. And usually they'll say, that's exactly where I'm hurting. That's the discomfort that I'm having. At that point, we stress to them conservative management initially. But when they fail to improve with the conservative management, then we can recommend a minimally invasive treatment that we do here in the office.
And what are those treatments?
Basically what we do is we're able to put a little catheter inside the vein. It goes through something that looks about like an IV. And as we heat up the catheter, whether it's a laser fiber or a radiofrequency catheter, and we use both here, it heats the vein, causing the protein to shrink down. When the protein shrinks down, it closes that superficial vein that's not working right. It closes it down, preventing the backwards flow and the high pressure that's built up in the leg and giving them a significant relief in their symptoms.
You mentioned restless leg syndrome. You have a unique treatment for that.
Well, restless legs are typically treated by medications.
Right.
If you take a colored bar soap, put it in an old sock, throw it down at the foot of the bed, in between the top sheet and the fitted sheet, for some reason, about 80% of folks have significant relief or resolution of their restless legs. I don't think anybody knows why it works, but it sure is a cheap, easy way to help people sleep better.
Well, Dr. Shuler, we know you are a very busy man, and we thank you for taking the time to be with us today. Now, if you have any more questions, you can contact Dr. Shuler at Vascular Associates.